Blessed day, future health students. Welcome to our second week of final term. Last week, you have learned about the types of health assessment, which is a key element in assessing and determining the patient's health problems and caring needs, and consequently have a crucial role in designing your care plans and determining the interventions. So with this second week, we shall learn about the sources of data and the health process, which will increase your capability to monitor the alterations in patients' health and contribute to make better judgment. So just a quick recap for your week 1 lesson. We have the types of health assessment. The first one is initial comprehensive assessment. So this describes in detail the client's medical, physical, and psychosocial condition and needs. So it identifies service needs being addressed and by whom, the services that have not been provided, barriers to service access, and services not adequately coordinated. Second, we have ongoing or partial assessment, and these assessments alert the health provider to changes in the health responses or patient's responses in terms of their health and illness. It also suggests necessary changes in the plan of health care or care offered by other healthcare professionals. Third, focus or problem-oriented assessment. It is a detailed health assessment of specific body systems relating to the presenting problem or current concerns required. So this may involve one or more body system. And the fourth one is emergency assessment. So these are the ABC's assessments such as the airway, the breathing, the circulation, consciousness, safety, which is the first assessment you will do when you meet your client or your patient. So this assessment is repeated whenever you suspect or recognize that your patient's status has become or becoming unstable. Now, what will be your role in this health assessment? So as future health provider, you will constantly observe situations and collect informations to make your clinical judgments. So this occurs no matter what the setting, such as hospital, clinics, home, community, or long-term care. So you will conduct many informational assessments every day. So for example, when you get up in the morning, so you check the weather and determine what would be the most appropriate clothing to wear. So you assess whether you are hungry. Do you need a light or heavy breakfast? When will you be eat next? Or when you even assess the physical condition of your skin, do you need moisturizing lotion? Then what are your family members doing? So with that, you will use this information to assess yourself and determine the actions that will influence your future health professional assessments you make on the client, to the family or the community, in determining interventions that directly or indirectly influence their health status. So now, let's take a look on the sources of data. So we have here the primary source. So when we say primary source, it is a person who is being examined. So it is the patient itself or the client itself. So they are the primary source. And for the secondary source, so these are the family members of the patient or the client or the significant others. So when we say significant others, any persons related to the patient, to the primary source. And of course, other healthcare professionals and the medical record. So these are the secondary sources in terms of the data. So now, what are the types of data? So first that we're going to take a look is the difference of these two terms, subjective data and objective data. So when it comes to your future career as health students, understanding the difference between the subjective versus objective can be critical in taking note of the situation and dealing with it is at most efficacy. So as health professionals, it can be easy to just look at the numbers such as the lab values, their vital signs, the tests, and then feel comfortable making a judgment on the patient's current state. Doing this, however, would fail to take into consideration any of the subjective data that a patient may be able to offer, such as how they are actually feeling, what happened, or any other additional problems or symptoms that they are experiencing. So with this in mind, we're going to define subjective data as well as objective data so that you are capable of differentiating between the two. Believe it or not, discerning the difference between subjective and objective data is quite simple. We just make it more complicated when we overthink it. So without further ado, let's learn about the difference between subjective versus objective data. There you go. So the first question is, I always read and hear the words signs and symptoms. So which is subjective and which is objective? So when we say symptoms, in Tagalog, sintomas. So any subjective. So therefore, symptoms is subjective. Okay, so any subjective evidence of the disease, it is a subjective experience of a potential health issue which cannot be observed by health provider. Examples: feeling hot, the pain, the numbness, the tingling sensation, or nausea. Therefore, symptoms is a subjective data. And when we say signs, therefore, it is the objective. Okay, so in Tagalog of signs, hudyat, senyal, senyas, what else? Babala or palatandaan. So therefore, it is any objective evidence of a disease that can be observed by others. Example, this might be the skin rash that indicates eczema, the rasping sound of a bronchitis cough there, or red rings around the eyes brought on by dermatitis. So those are observable data. So that's why it is a sign. There you go. So now let's take a look on the subjective definition or subjective data definition. So these are information is often shared verbally with you or in the way that the client can be best communicate. So subjective data are information from the client's point of view, as what I've mentioned earlier, symptoms. So including their feelings, their perceptions, and concerns obtained through interviews. So subjective data is going to be information that you receive from the patient or from one of his or her knowledgeable companions, which are the significant others or family members. And subjective data is what you are able to pull from the patient as the primary source of data, such as how they are feeling, what are their symptoms, and their current concerns. Alright, so if you're suffering from health condition or if you had suffered from it, you certainly would have exhibited some common symptoms. So for example, if it was a common cold or flu, for example, if you have this kind of symptoms, so if I will be your health practitioner for today and due to upsurge of COVID cases, it is very difficult to go out and have a consultation, then you will call for me for a talk. So as a health practitioner, I will be asking you several questions and you shall respond and might answer you. You will have had a runny nose, a body chill, or cough. So these are your point of views, your feelings towards your illness. So now let's take a look on an overview of examples of subjective data. So subjective data, information that the client shares with you spontaneously or in response to your question. So example, client states, I have a rash on my ankle and leg for the last 2 weeks. Another example, the parent states, my 8-month-old son is having trouble breathing. Another example, the client's reason for seeking care is diarrhea for 10 days. And the fourth example presented here is the client types, I feel sick to my stomach. So as you notice, these are all verbalizations to what happened in their current condition. So that's why they are informations that shares with you spontaneously, or any response in terms of your questions. Okay, so we have now, so that's for the subjective data. So now for the objective data, so these are the information involves the collection of information through observation. So in healthcare environment, the senses of seeing, hearing, smelling, and touching are used to gather information about the patient and the patient's behaviors, actions, test results or the lab results, measurements, and the physical examination are also included under the objective data. Okay, so here is an overview and examples of objective data. So as what I have mentioned earlier, these are measurable data, signs, and obtained through observations, physical examination, laboratory, or diagnostic testing. So we have here measurable examples such as the heart rate. For a normal range of heart rate for an adult or in your age as of this moment, it's around 60 to 100 beats per minute. So for blood pressure, this is also unmeasurable. So usually the normal is 120 to 80 millimeter per mercury, but it depends upon the person. Some they have a normal blood pressure of 110/70, 100/60. That's fine. It depends upon the people. Then respiration or the breathing. So this is also unmeasurable. And the normal for an adult or in your age is around 12 to 20 cycles per minute. Then we have also the wound appearance, if it's visible, if there is a wound present into the client or patient, and ambulation description. So when we say ambulation, if the patient or the client is able to walk by themselves without any assistance. So these are examples of objective data that are observable. All right, so how do you get objective data? So of course, first is reading the patient's body language and noticing specific behaviors. So lack of eye contact could mean the patient is shy. What else? A patient complaining of a stomach ache may lay in a fetal position. So when we say fetal position, if you saw already an infant, so wherein they are curved at some point. So some point, maybe they are experiencing stomach ache. Another example is that rubbing the hands together may mean that the patient is nervous. Okay, so the second one is use specific tools and techniques to gather more forms of objective data. So the last time you went to a doctor's checkup, you saw a stethoscope, wherein probably they use it to take your blood pressure or to hear your breath sounds. A thermometer, I believe you're familiar already of thermometer to obtain the body temperature. Another example is you may have tests performed. You may undergone already an x-ray or blood work that had results. Also during physical examination, so the doctor may have touched a specific body part to check for pain by watching your facial expression. So these are some ways on how to get objective data. So there, so just to sum up on the subjective and objective data, there you go. So for subjective data, so anything stated that cannot be very verified, such as feelings and pain. Example, feeling dizzy, they report falling down at the stair. Then for objective data, measured metric, observed data using the 5 senses as what I have mentioned. So we have the heart rate, or if there's a bleeding and so forth. Okay, so this is a table presenting the comparison of the subjective and objective data. So subjective in terms and objective in terms of description, data elicited verified by the client. For the objective data, directly or indirectly observed through measurement. And for the sources, we have, for the subjective, we have the client, family, and significant others or other healthcare professionals. For the objective, there, observations and physical assessment, finding of the health provider or other healthcare professionals, documentation of assessments made in the client's record, or observations made by the client's family or significant other. And examples, under subjective, any verbalization that comes from the patient, such as I have a headache, it frightens me, I am hungry. On the other hand, for objective, vital signs, the respiratory rate, the blood pressure, the heart rate, the x-ray, and any laboratory tests or results. So now let's examine some scenarios based on the types of data. So we have here the first scenario. So you have a 48-year-old male patient who comes in stating, I feel like I can't breathe. Patient's respiration are 28 cycles per minute and their heart rate is 115 beats per minute. The patient then grabs his chest and says, my chest hurts so bad, please help. You ask the patient to rate the pain on a scale of 0 to 10, and 10 being the worst pain ever. And then the patient replies, 10, it hurts so badly. You then ask the patient to describe what the pain feels like, and the patient reports that his pain feels like pressure. Your patient then starts to become diaphoretic. When we say diaphoretic, pinagpapawisan, and pale, namumutla. So you take an ECG or electrocardiograph that shows tachycardia. So tachycardia, there is already a fast heartbeat. Then the pulse oximeter shows 100% on room temperature or room air, and the patient's blood pressure is 120 millimeters per mercury. Okay, so that's the first situation. So the first step is read per sentence if subjective data is present. Not necessarily subjective data is present each sentence, but to ensure that we gather all the subjective data, we read per sentence. So in the first sentence, it says here, you have a 48-year-old male patient who comes in stating, I feel like I can't breathe. So therefore, there is a subjective data. So what are the other subjective data presented? We have here, my chest hurts so bad. There. So we also have here the pain scale of 10. It hurts so bad, as what presented on the previous slide. Pain is a subjective data. And of course, the patient describes to you the pain, how they feel in terms of the pain. And the patient responded like a pressure. So therefore, these are your subjective data. So now, let's take a look on the objective data per sentence. So as what I've mentioned, not necessarily per sentence, subjective or objective data is present, just to ensure that we gather all the subjective and objective data, we read per sentence. So in this scenario presented, so these are your objective data. So the biographical data, the age of and the sex of the patient, the vital signs, which are the respirations, 28 cycles per minute, and of course the heart rate, 115 beats per minute. We also have here the diaphoretic and pain, and of course the ECG that shows tachycardia. We have here also the pulse oximeter, wherein it is 100% on room air, and their blood pressure which is 120 millimeters per mercury. So why? So now let's take a look on the summary. So there we go. So I just put it on the table. So now if you're going to notice on this data, why do you think that the shortness of breath is subjective? The reason behind that is because the patient is telling you how they feel, and they feel that way, that they are running out of breath. And if the health provider noted accessory muscle, using the accessory muscle would be the objective, and the feeling of shortness of breath would still be subjective. So the diaphoretic and the pale skin condition is objective because of you can see those in the patient. So that's how we dissect a situation and put it in a table to separate objective data and subjective data. Now, let's take a look on the situation 2. A patient tells you they got their finger cut with a razor about 20 minutes ago and then shows you the cut on their finger. The cut is 1 inch long, located on the left pinky finger, about 1 centimeter deep. The patient states, "My finger is bleeding. Can you get me a gauze for the blood?" So, same step. So, per sentence, let's take a look on the subjective data. So, we have here, patient tells you they cut their finger with a razor about 20 minutes ago. So, that's the only subjective data. We also have data we can show. We also have here, "My finger is bleeding. Can you get me a gauze?" Since it is verbalized by the patient or by the client. So now we have the step 2. So let's take a look on the objective data. So we have here, the patient shows you that they have a cut on their finger about 1 inch long on the left finger, and it is 1 centimeter deep. So now let's put it on a table to separate the subjective and objective data. So there you go. So that's how we separate subjective and objective data. So the complete subjective health assessment is part of assessment, and the first component of the health process, which is the assessment, planning, intervention, and evaluation, which will be discussed as we go along, is outlined here. So as illustrated here, the assessment phase of the health process involves collection of subjective data and collection of objective data. So after you collected the subjective and objective data, this is already your assessment. And from there, you will already plan, create your intervention. All right. Then you evaluate if the interventions you made was successful to reach the goal that you set on the planning. And if it's not, you need to do again reassessment. So that's why this is a cycle. So if your planning is not met, what I mean by that is not successful, so you need to reassess again and do another planning and create another intervention until such time the patient or the client is really feel well or free from any diseases or illnesses. With that, we now discuss about the health process. So the health process is the problem-solving model for the health provider. And the health process consists of assessment, we have the planning, the intervention, and evaluation. So in the health process, you have to look on the patient from head to toe, and also the family and community support. Next, you plan on the things you should do to resolve the problem identified. And afterwards, you will create an intervention and implement those intervention to the patient or client. And finally, you're going to evaluate whether what you implemented, if it improved the client's or patient's condition or not. So the health process is a thoughtful, deliberate use of a problem-solving approach to health providers. And this process will form a structure by which you function. So we have here the phases of the health process. The phase 1, assessment, which is the collecting of subjective and objective data. The phase 2, determining the outcome criteria and developing a plan. Phase 3, intervention, carrying out the plan. And phase 4, evaluation, to assess whether your outcome criteria have been met and revising the plan as necessary. So for the first, we have the assessment. So it is the collection of information or data necessary to determine the patient's health status and to understand the patient and strengthens the problem more clearly. So assessment is a process of gathering information, analyzing information, and of course identifying the problems. These are the basic skills in gathering information. So we involve here activities, the collecting of subjective and objective data. So let's take a look on this case study and let's dissect the subjective and objective data. So John visits the school clinic because he was feeling sick. When he is called back from the waiting room, the health provider on staff takes his temperature, respiratory rate, heart rate, and blood pressure. And the results of his vital signs are 38 degrees Celsius, 30 cycles per minute, 110 beats per minute, 110 millimeters per mercury. She then asked John a series of questions about how he's been feeling lately. And John states, "My body feels hot and I feel dizzy." The health provider notes his response and noticed difficulty of breathing as he labored while breathing in. So for step 1, we identified assessment. What are the subjective and objective data? So based in this case presented, your subjective data is, my body feels hot and I feel dizzy, because that is the verbalization of John whenever the health provider asks John how he's been feeling lately. For the objective data, the results of the measurable data, which are the vital signs, the temperature, the heart rate, the respiration, and the blood pressure. And also we have here labored breathing, because while John is breathing in, the health provider noticed that he is in labor while breathing in. So therefore, we put this in a table to separate the objective and subjective data. So there you go. So we have the temperature. So 38 degrees Celsius, the respiratory rate, 30 cycles per minute, heart rate, 110 beats per minute, blood pressure of 110 over 80 millimeters per mercury, and labored breathing. So these are all observable data. Especially these first 4, these are metric or measurable. Then for the subjective data, the verbalization of John, and states, "My body feels hot and I feel dizzy." So that's for the assessment. For the planning, it is a plan of care developed in cooperation with the patient and significant others. So the plan of care is aimed at reducing or limiting the problems and, of course, promoting health. And in creating plan, we need to follow this rule: SMART: specific, measurable, attainable, realistic, and time-bounded. So the planning stage is where goals and outcomes are formulated that directly impact your patient care. And these patient-specific goals and attainment of such assist in ensuring a positive outcome. So Step 2 is to create your goal, create the planning, and follow the SMART rule. So based in this assessment data that we gathered for the subjective and objective data, so this will be our planning. There you go. So at the end of 6 hours, the patient or client intervention, patient will be able to body temperature will return to normal range from 36.5 to 37.5 degrees Celsius. Respiratory rate will return to a normal range from 12 to 20 cycles per minute. A heart rate will return to normal range from 60 to 100 beats per minute and feel warm and free from dizziness. Now, so in creating a goal, so if you're going to take a look on the assessment, so the temperature is 38 degrees Celsius. So this is not normal. So patient is already experiencing a fever. So of course, our plan or our goal is to maintain or return the body temperature into a normal range. Then for the respiratory rate, 30 cycles per minute. So this is above the normal. So therefore, our goal is to return to a normal range. The heart rate, this is above the normal. So therefore, our goal is to return to a normal range of the heart rate. And of course, feel warm and free from dizziness. Okay? For the labored breathing kasi, dito may fever si patient. Tapos, it shows kasi yung kanyang respiratory rate is 30 cycles per minute. So, mataas, kaya labored breathing, nahihirapan siyang huminga. And based on the subjective data, sinasabi ni patient na ang nararamdaman niya is nahihilo at mainit ang pakiramdam. Sa paggawa naman ng time frame, 6 hour, this should be specific and realistic. 'Di ba kapag meron tayong fever, in just a span of 4 hours, pagkatapos nating gawin yung mga other interventions, usually bumababa na yung ating vital signs. So that's why in creating or planning, arrange a time frame in your planning, it should be realistic and measurable or realistic na talagang ma-achieve nyo yung plan or goal na create ninyo. So that's for the planning. For the intervention, so the interventions and activities are then performed and you continue to assess the patient to see if there is any response or whether the intervention made a difference. So implementation is the step which involves action or doing or the actual carrying out of health interventions outlined in your plan of care. So this phase requires health interventions such as direct or indirect care, medication, and standard treatment. So the step 3 is to create an intervention to achieve the goal. So based on the gathered data, based on the goals that we set for the planning, so this will be our intervention. So we need, of course, if a patient is with high body temperature, so we need to instruct to remove some excess clothing and wear clothing that is thin, that is easily absorbed by sweat. Diba? Kasi kapag mataas ang body temperature natin, kapag makapal yung suot nating damit, tendency is hindi ma-release yung heat sa katawan natin. Okay? So next is we need to encourage increase oral fluid intake kasi kapag ang pag-inom ng maraming tubig is nakakatulong sa pagbaba ng temperatura ng katawan natin. And of course, tepid sponge bath. Itong tepid sponge bath, ito yung tinatawag natin labar. Ayan, yung babasain natin yung bimpo ng tubig tapos yun yung pampupunas sa katawan para ma-relieve yung init ng katawan ng pasyente. Then, we also have here maintain good ventilation environment kasi syempre kapag nilalagnat, kapag hindi naman nag-chills or nag-shiver si patient, maganda kapag merong air circulation sa room ng pasyente or ng client ninyo. Then, provide medication as prescribed by the physician. So, kung kinakailangang may gamot, kung may prescribe na gamot si physician, so, kailangang painumin para gumaling, bumaba yung temperatura sa katawan. Then, of course, we need to encourage bed rest or minimize movement. So, with this intervention, it can help in achieving the plan that you set in order to make sure that the body temperature, the respiratory rate, the heart rate, and the subjective data that you collected will go back to its normal. Yan. So that's for the intervention. So of course, after the intervention, after you implement those interventions to the patient or to the client, we now evaluate. So when we say evaluation, these are determining whether the plan has worked and whether changes needs to be made. So this is the final stage of the health assessment, where it is very vital to a positive patient outcome, whether a healthcare provider intervenes or implements care, and they must reassess or reevaluate to ensure the desired outcome has been met. So reassessment may frequently be needed depending upon the overall patient condition. So the plan of care may be adopted based on the new assessment data. So let's take a look here. So for the step 4, so now we assess the patient and evaluate the effectiveness of the intervention to determine if the planning that we set is achieved. So there you go. So at the end of 6 hours, because this is the plan that we set, the time frame that we set. So based on the intervention, let's assume that patient's condition is went to normal or went good, where in fact with these interventions that we presented here, talagang babalik sa normal range yung mga vital signs ng pasyente. So therefore, what we put in the evaluation here is the data that you gathered in terms of the temperature, the actual temperature that you gathered, 37 degrees Celsius. So this is within the normal range. The respiratory rate, 17 cycles per minute. This is on the normal range. Then returns the heart rate into a normal range. 89 beats per minute is in a normal range. And of course, the response of the patient. Whenever you ask the patient, for example, ma'am, sir, kamusta po kayo? Mainit pa rin po ba yung pakiramdam ninyo at nahihilo pa ba kayo? Then from that, whatever the response of the patient or the client, we put that under the evaluation. So that's for the final stage. There you go. So that's for the sources of data and the health process. So thank you very much for listening, and I hope you have learned something about the week 2 topics. And if you have any questions, feel free to contact your Funda 2 subject teachers for assisting you in creating your health plan.